OK, if the Prime Minister and the Chancellor for, 2 hours and 38 minutes at the weekend, if they were of the view that it was perfectly safe for them, who come into contact with an awful lot of people, including, of course, the Health Secretary, Sajid Javid, who does have COVID and is self-isolating for that reason. But if the Chancellor and the Prime Minister thought that it was perfectly safe for them to use this mythical pilot scheme available only to cabinet ministers like him and like them and Michael Gove to continue to work having had a negative PCR test despite everyone else having to self-isolate, why is it safe for them and not safe for everyone else?
Well, obviously they changed that decision.
No, but they thought but they didn't change it because it was unsafe. They thought it was the right thing to do, apparently. Why would it have been safe for those 2 hours and 38 minutes for them to do that?
Well, the truth is that from the middle of August, we're going to move to that system for everyone. So anybody who is pinged will be encouraged to get a test. And if they test negative, they can return to work. That's the system we plan to move to. Now, I know it's frustrating for everyone, as many things about this pandemic are frustrating. The reason we are maintaining this test, trace and isolate system just for now is that you will see that the infection rate is rising sharply. There will be an increase in hospitalizations that follows that. The vaccination reduces hospitalizations by some 95%. So it gives us the confidence to basically allow that infection rate to creep up with a high degree of confidence that it won't lead to too many hospitalizations. But we do just need to be mindful of where that peak will be. So we're maintaining these just for a few more weeks to try to spread the peak in this, infection as we exit lockdown.
We're back to flattening the curve. That's a simpler, happier times, George. Can I go back to the question I asked?
Well, we are flattening the curve in that sense, and I think, Julia, look, you and I have discussed this many times during the pandemic. You're someone who's been quite sceptical about many of the measures and the convoluted nature of the lockdown. We are trying as a government now to chart a way out of this. So we have gone to the final removal of the restrictions, but we're still just keeping these final remaining tools to help us.
I've not been sceptical. I like to go with evidence-based policy and cost-benefit analysis, which is how we used to do government, and that was why I've been critical of government policy where it has not been properly costed, and we haven't seen the costs or benefits of those policies. Can I go back to the question I asked you? If the Prime Minister and the Chancellor thought it was safe for those 2 hours and 38 minutes for them to do it, and if it's safe also for other critical workers to not self-isolate, and it will be from August the 16th for all of us to not self-isolate if we've had a negative PCR test, if we've had a contact with someone who's got COVID, why is it not safe for all of us now?
Well, because the evidence is that if somebody's been in close proximity to someone who's infected, they are 5 times more likely to become infected themselves.
Which is why they should take a COVID test.
Exactly. And the tests help, but they're not perfect. And they do sometimes, someone can test negative and then they can end up testing positive a few days
later. Which is why they take lateral flow tests for the next few days. So we've already resolved. So we know. Is the reason why we're not doing this until August 16th actually about keeping people in a version of lockdown? That lots of people are conspiracy theorists think that this is really a cunning wheeze by the government to do this. Is it because we don't have the testing capacity? Is there another reason behind this other than just sort of no one really thought this would happen? It was a little bit of an accidental side effect.
We didn't quite know what the speed in growth of the infection would be as we came out of lockdown.
Yeah, well, you had SAGE models that suggested it would be around this level.
Exactly, but you didn't know entirely where it would plateau out. The point, though, is we are going to move to this system where everybody can test and carry on working from the middle of August. For now, we've put in place the ability for that to happen expeditiously, effectively, early in some of these key strategic areas. We think that's the right approach.
I know you think it's the right approach, and I think it seems very, very sensible that people should be allowed to do that in critical industries. What I'm asking you is, why on August the 16th does it become safe for all of us to do it when it isn't safe for all of us to do it now?
Well, it becomes it is safe it is a safe approach, and it's the approach we're moving to. But the safer approach, the safest approach, is for people to isolate. And we know that if people respond to the app and do isolate, for every 1% of people who basically have the app and follow what comes from it, there's a further 1% reduction in the infection rate. So the reason isolating is more effective is it does spread that peak. you can do what we are doing, which is allow some exemptions in small numbers of cases without affecting that overall objective.
Okay. Do you agree with Jeremy Hunt, the former health secretary, who said that with this pandemic and not moving this the August the 16th date forward, that actually the government is risking losing social consent?
Well, look, it's definitely very frustrating for everybody to be pinged and asked to isolate. We absolutely understand that. It's just for a few weeks more. We're just asking for people to bide with us, help us make sure that we can spread that peak, reduce that peak, because we do know that there will be a peak in hospitalizations that will follow some 2 to 3 weeks later. That's the bit that we're concerned about. That's what we're mindful of. That's why we want to try and spread that curve.
I think a lot of the business and industry leaders who've written to the Prime Minister today saying they want that date brought forward, representing hospitality, retail, transport and many other food supply industries, their point is, well, actually, there isn't any extra risk of spreading COVID or hospitalisations or deaths from perfectly healthy people proving they're perfectly healthy with a negative COVID test or more than one, and going back to work. And you say it's just a few more weeks, but it's been just a few more weeks for many of these private sector businesses and public sector for 16 months now. They're struggling. They're on their knees, and they need to get their staff into work so they can actually run their businesses. A few more weeks till government civil servants and politicians like you on a full payroll is fine. It's much harder for people in the private sector.
Well, look, it's because we recognise the impact that this has had on businesses that we have gone to that final stage of exiting lockdown. And we know that the people being pinged by the app and asked to isolate, is causing some pressures, obviously, and staff absences in many areas are running at about 15% at the moment. We do understand that, but we're not doing it for nothing. We are doing it to try to take the peak off this current wave as we exit all the restrictions. Okay. And we are one of the few countries in the world that have taken this step, having got ahead and vaccinated very early, to actually now move to exit all restrictions.
Okay, we're not exiting all restrictions. The government's going to be bringing in vaccine passports at the end of September. We were told initially we were told it wouldn't happen. Then we were told a few days later it would. It was for nightclubs. A lot of people saying, oh, well, I don't go to nightclubs, it's fine. But now we're told it could be anywhere where there's a large group of people: concerts, cinema, theatre, sports venues, even churches, synagogues, mosques and temples. Are you happy to be in a government which would require people to show their vaccine status at the door of a church?
Well, look, we would obviously prefer not to, and the Prime Minister himself has said that he doesn't want this to be used in pubs, and we want it to be used very, very sparingly. We think there is a case for it in the case of nightclubs, because they are crowded venues where the risk is higher, but we're not going to use this unless it's necessary. I do understand, that argument, but equally, at this stage, we just need to make sure that we don't rule out some of these tools that might be needed to try to manage, an endemic presence of the coronavirus over the medium term. We can't rule things out, but it is quite possible equally that when we get to the autumn, we will have turned the corner on this and we won't need to do it at all.
A bunch of young people, perfectly healthy, at very low risk from COVID. 60% of that group of people already have had their first jab. Why on earth would it be needed?
Well, in the case of young people, the numbers that have had the jab, I think, is much lower at around 30% at the moment. We do want to increase that. We're doing a lot of work to encourage more of those to take their vaccine. And I think, many of them may well think that it would be worthwhile getting it if it's going to help them access the things that they love.
We used to call it blackmail, but there we are. George Eustice, Environment Secretary. I very much hope you don't do that, but I hope you don't do it for your sake as well as for the young people's sake and others going, because I think the backlash to this in years to come is going to be much, much huger when people do wake up to their freedoms being taken away like that. But I so appreciate George Eustice, one of the ministers who actually got the guts to come on the show and answer questions. So all credit to him for that.